Good morning. This is Paula's Desk Health Tip. I've been on low dose naltrexone for probably 4 or 5 years. I uh, I have rheumatoid arthritis. I got it right after my son was born, and he is 51. I have been on everything that you can think of. And I had a very severe case. I have deformities in my hands. They're not as bad as some, but I do have damage in my hands, and I've had a little hand surgery. I've had fusions in my feet. I've had a little knee surgery. So I have suffered the side effects of rheumatoid arthritis. For years, every morning I'd wake up, I felt horrible. I hurt everywhere. I felt like I had the flu every day of my life. Um, I was trying to um, finish my degrees and teach, and I would have to get up early and take medication and take a hot bath just to be able to even go to work. So it was a horrible struggle. Rheumatoid arthritis is a horrible autoimmune disease, as all of them are. Um, but I wanted to talk to you about the difference that low dose naltrexone has made for me. I don't hurt anymore. I walk every day. I feel great. It has made a huge difference in my life. I I don't take anything else. I don't take any other medication. Uh, at first, when I was just starting the low dose naltrexone, I if I had a flare, I would take 5 milligrams of prednisone, or I'd take naproxen sodium just to get through that. But low dose naltrexone is not one of these medications that's going to happen overnight. It takes probably, in 2 weeks I was feeling better. Some people it takes a couple of months, but it's worth it. It is so worth it. And a lot of people ask me, well, what is this and how does it work? And um, naltrexone has been around for a long time, and they originally used it for people that were addicted to opiates. And 50 milligram, they would give them 50 milligrams, and if they took the opiates, they would get violently ill. And it didn't work very well because the drug addicts would quit taking the naltrexone, and because it did make them so sick when they took the drugs. And so around the 1980s, when AIDS was really becoming a great problem, they noticed that the AIDS patients that they were giving the naltrexone to for opiate abuse were getting their autoimmune disease, and a lot of other things were getting better. Cancers, MS, all kinds of things were getting better. And so they had started them out at the 50 milligram and were lowering the dose as they went, and they found that the 4.5 milligram every day was all you needed to help stabilize your immune system. I'm not sure how it did with AIDS, but they did find that it was great for autoimmune disease and for a lot of other things. There are some sites that say it's great for cancer and for MS and lupus and fibromyalgia and all those things. I can't attest to that, but I know it works for rheumatoid arthritis. It's been amazing for me. I will tell you that the doctor that prescribed it for me, he was just a godsend. I just think he was sent by God for me and for a lot of other people, I would imagine. But we discovered a couple of years ago that my husband has type of autoimmune disease also. So we went to Dr. Johnson, and he put Paul on 9 milligrams of LDN, and I thought, I'm going to start 9 milligrams. I was taking the 4.5, and when I first started, I took it at night. I couldn't sleep. It was not good for me. I'm not a good sleeper anyway, so it was not great for me. I kept taking it because it was working so well. But after my husband was given a prescription for that, I thought, it's not going to work for both of us to be awake all night. So I started giving it, we both take it first thing in the morning on an empty stomach, just so that it gets absorbed before we eat breakfast or take vitamins, or, my husband's on blood pressure medicine. So that's how we take it, and it works just as good. You don't have to take it at night, as far as I know. They do say that the way it works, that it's supposed to work better at night, but I haven't noticed any difference. It works just as well taking it first thing in the morning. So, and I sleep better at night, and so does my husband. I just wanted to tell you a little bit about how it works. Low dose naltrexone is an antagonist for opiate endorphin receptors. And what that means, when you first take your LDN, your low dose naltrexone, it blocks those opiate receptors, but as it wears off, those endorphins just go crazy. They just increase so much, and that helps stabilize your immune system. And so once those endorphins start producing, it's just like, I had heard that they produce 1,000 more than what they regularly do. And people with autoimmune disease and with health issues have low endorphins. That's why you feel bad, you get depressed. I probably suffered from depression for years with my rheumatoid. It also reduces the speed of unwanted cells growing. So that's really good. And I was going to go up here. I also have some other information. So it's basically what I've told you. And endorphins are your natural peptides produced in many cells, which regulate cell growth, including your immune cells. Many patients who have autoimmune disease tend to have low levels of endorphins. So opiate receptors are in the central nervous system and the GI tract. So by using LDN, you receive a brief blockade, creating a rebound effect, giving you more endorphins. Endorphins make you feel good. They're a good thing, believe me, including an increased production of the OGSF receptors. Clinical experience shows that in less than 10% of the cases treated, increased introductory symptoms may be more severe and more prolonged than usual, lasting sometimes several weeks. Rarely, symptoms may persist for 2 or 3 months before the appropriate beneficial response is achieved. And basically what that's saying is that when you start taking it, because the endorphins are cleaning all this gunk out of your body and helping your body immune system stabilize, you may feel bad. You may feel worse at first for the first couple of weeks. And it said not more than 2 or 3 months. But I felt good in 2 or 3 weeks. So just I really highly recommend don't quit taking it. One thing that you've got to remember, you can't drink a lot of alcohol, and you cannot take opiates or narcotics You just cannot do that, but it is so worth it. Why take those when you don't need to? They ruin your brain, your body, your kidneys, your liver, everything, and you are not going to need those. If you can get by without taking them, just take uh, Aleve or ibuprofen or whatever until your symptoms get better. I will tell you, after my husband got on this, and I'm not saying he's, you know, totally uh, healed or anything, but I feel like I am. But he does have some days where he hurts a little bit. But, you know, as women, we're better at our diet and taking care of our health than men are. But he feels so good. My son said he was walking like a little old woman there for a while, and he's not doing that anymore. He's walking our dog about a mile every day. He's remodeled my bathroom. He's remodeled our living room and put rock on the fireplace. He's feeling so much better, and so it has helped him a lot. But I was just going to try to see if there's anything else. So I think the main thing to remember is stick with it. Don't give up. And, you know, alcohol is a poison for your body anyway. You don't need it. And it causes inflammation for one thing. And the low-dose naltrexone is such a wonder drug. You just, it will be so worth it to give up alcohol or any narcotics that you're on. The other thing that I wanted to tell you is that there is a website. It's called ldnresearchtrust.org, and I'll put it at the end of this video so you can see that. I would go on there. They have a lot of information. I believe they have places where you can, of doctors that prescribe LDN, and pharmacies. I get mine from Belmar Pharmacy in Colorado Springs. It's not in Colorado Springs, it's in Colorado. But I will give you their name and phone number too. But you do have to have a prescription from a doctor. Luckily, our doctor in Rock Springs, Wyoming, became educated about this through a patient from New York. He heard about it, and thank God he did. It's made such a huge difference in my life. Now, I will tell you, I also watch my diet. I don't drink pop. I don't drink sugary drinks. I can't drink fruit juice. Apples bother me. I know what bothers me, and I don't eat those things. So with the diet and the low-dose naltrexone, I feel great, and you will too. I just hope this works for you. It is amazing. Thank you so much.